Welcome, everybody, to a very special edition of the Cool Soror Podcast. You know, generally we sit down with members of the Divine Nine, primarily women. But today we are talking about women, and joining us today is a man who is specialized in helping women, particularly Black women. Dr. John Litman is joining us today to talk a lot about fibroids and what he is doing in his practice to make sure Black women in particular live a full life. Dr. Lipman, thank you so much for joining the Cool Soror Podcast. And I see you have your pink on. I like that.
Yeah. I was trying to represent.
Yes, he is representing. Of course, we represent all of the ladies across the Divine Nine. I am a member of Alpha Kappa Alpha Sorority Incorporated, so I appreciate the love that you are sharing with us today. Let's talk a little bit about you and how you even started your practice. I want to know your background first, and then we'll get into what you are doing to help the lives of so many women.
Well, I went to medical school at Georgetown, did my radiology residency at Harvard. Then I did a fellowship in interventional radiology, which is a specialty within radiology to treat women, as we're going to talk about, at Yale. And then I came to Atlanta about 32 years ago. And I've been practicing here ever since. My practice is the Atlanta Fibroid Center, so we treat women that are suffering with fibroids completely without any surgery whatsoever. It gets the relief of symptoms they're looking for. They avoid the risks and long recovery of an operation. And importantly, and often very underappreciated, they get to keep all their parts. They keep their uterus, which is huge. Yeah.
So just talk about how you even discovered this particular procedure.
Well, I didn't discover the actual procedure was discovered in France. And by accident, as a lot of things in medicine are discovered accidentally. I had been treating, and along with a lot of other people, treating cancerous tumors. By blocking the blood flow to the tumors, it makes it an easier surgery for the tumor to be removed by a surgeon. Less anesthetic time, no blood loss, very easy. So someone got the bright idea in France, why don't we embolize benign fibroids prior to hysterectomy? It made sense. It make it an easier surgery because fibroids are very vascular too. So the group in France started doing this in the early 1990s. And what they discovered was the system in France, the healthcare system, is unlike what's going on in this country. It's socialized medicine. So it's rationed healthcare. So you can't just get a procedure done, particularly if it's elective, as this was. The hysterectomy was elective. They'd get their embolization and they'd go home and they'd wait 6 weeks, 7 weeks, 8 weeks for their elective hysterectomy. Unlike in this country, you just have it same day, next day. But they were waiting because it's rationed, socialized medicine. So they were waiting for all this time, 6 weeks, 7 weeks, 8 weeks. Their symptoms started going away. And the women were calling up their gynecologist saying, I feel great. Do I need that second part? Do I need the hysterectomy? Because my symptoms are gone.
Wow.
And when they looked at it, the answer was no, you didn't need the second part. All you needed was the embolization. And I was presenting data on embolizing cancerous tumors in Chicago at the same time that the first guy that was doing fibroid embolization in this country was presenting his data, because the guy in France, his best friend was the chief of OBGYN at UCLA.
Okay.
And he said, get the interventional radiologist on this. And Scott Goodwin, who presented the first 11 cases, we were at the same, presentation, and the light bulb went off for me. I'm like, I know exactly what I'm going to do now. I'm in Atlanta. I could help so many women, and I've been doing them ever since, and I have the largest experience worldwide now in this procedure called Uterine Fibroid Embolization, UFE.
Yes. So let's go back before we dive into uterine fibroid embolization. Did I say it right?
You did.
Okay, great. Let's jump back. Why are so many women, particularly Black women, suffering from fibroids? 80%.
Yes, at least.
At least.
Yeah. Well, it's multifactorial. Unfortunately, and we can talk about some of this, we don't know where fibroids come from. And that's really due to a serious lack in research and a huge disparity. And we can talk about that separately. But so we don't know where fibroids come from. But once they arrive on the scene, they grow with estrogen. And so estrogen is stored and produced in body fat. And in general, African American women have more body fat than other racial groups. Asian women have the lowest body fat, lowest incidence racially of fibroids. But that's not the whole story, because there's a lot of other factors. Genetically, it runs stronger in African-American families. Vitamin D is really big.
Wow.
Vitamin D is actually a hormone. It's not really a vitamin. But vitamin D is the most powerful anti-fibroid growth substance that we know of. And if you have a normal vitamin D, you are very unlikely to be suffering with fibroids. Only 10% of African American men or women have adequate vitamin D. And the darker the pigment of the skin, the harder it is to absorb and to get adequate vitamin D. So what we try to do is, you can't control the genetics, you can't pick your parents, but we try to get people to try to lose excess body fat, make healthier eating choices. There's a lot of hormones in the food. Try to limit or eliminate red meat, non-organic chicken, dairy. Eat more colored fruits and vegetables, which have flavonoids in them, which block an important enzyme in estrogen production. Make sure your vitamin D is adequate. If not, supplement as necessary. Try to be as close to your ideal body weight. There are a number of things that you can do that will make your fibroid symptoms either manageable or maybe even eliminated.
So I do want to, in all transparency, I feel like I do have an important platform, and I want to let my viewers and followers and people who have followed the Rashan Ali brand and also the Cool Soror Podcast that I do not suffer from fibroids, and I've had a really, really healthy reproductive life. But I do feel like this is my responsibility to be able to share this type of knowledge with women worldwide. So I just wanted to make that disclaimer as well. Dr. Litman, a lot of people will say, well, what is this guy? I mean, what does he really want? And I'm sure that you've been faced with that type of scrutiny, because let's talk about it. It's real. It's about race when it comes down to things, to so many things. It's like, who is this guy trying to say he has the magic thing for these black women?
Right. I'm
sure you face that. And what do you do to kind of battle that or buffer that or rebuttal those type of sentiments?
Well, I mean, it definitely is real. And a big part of that is because of our horrible history in how we've treated women of color, particularly when it comes to their uterus. You don't have to go into depth, but there's the Fannie Lou Hamers and the Mississippi appendectomies. And so we're in the South.
Henrietta Lacks, all of that.
Correct.
Yes.
So, that's real, and that's our history, and that's something that I am very cognizant of. And I want, when patients come to me, I want them, one thing that's never failed me in the 32 years of practice is I treat every patient like they're my mom, my sister, my wife, my daughter. And I think it resonates with them. I think they see that. They see that I want to help them. And so not only do I want to help them, I realize I serve women, and I serve women primarily African-American women, women of color. I am out in the community a lot.
Yes, you are.
And so, they can see what I've, felt. I feel a responsibility as a business in the community. I feel a responsibility to that community. And I think that I've done quite a bit. I've set up a number of scholarships at Morehouse School of Medicine. I've financed research in pancreatic cancer for a really good friend of mine, Simon Baby, who passed away from pancreatic cancer. I've given a lot to Hosea, helps feed the hungry, got them in their new building. So I do a lot of philanthropic efforts that I feel my heart's drawn to, to try to help where I can. I'm only one person, but I help when I can do that. And I do. I feel a strong responsibility. And hopefully the patients that come to see us realize, that background, and realize that I do care and that I'm trying to help them, and really invested in the community.
Yeah, and recently you were at Tuskegee, one of our amazing HBCUs, and talking about your procedure and women in general and fibroids. And then you had a couple of women come up to you afterwards saying, hey, I'm in my 30s, and my doctor said I needed to have a hysterectomy. So their lives are completely changed because they got that one person that told them they need to go ahead and just take everything out, and they did without a second opinion. Can you speak to those women who are hearing that? Because my mother in 1992 heard the same thing, got a hysterectomy, which forced her into menopause early, very early, and I was 17 years old. Never got a second opinion.
The average age of hysterectomy in this country is less than 40, and the women that you mentioned that I saw at Tuskegee, 3 of them, all under 30, had already had the hysterectomy. They were in their late 20s. None of them wanted it, but they were suffering so badly with the heavy bleeding and the pain and this monthly, misery that they had to go through. I mean, what women go through when they're suffering with fibroids is incredible to me. Not only the physical things that they go through, because, the bleeding is so heavy, they get anemic, they're tired, they're weak, because they've lost so much blood that
Yes.
they can't replace, but it's the mental aspect. These women commonly were maybe the only woman in the workplace. They're working with other men that don't understand what they're going through. And they feel a responsibility not to let them down, because not only do they not want to look bad, let's say, for themselves, they're looking at the next hire. I'm representing not only women, but women of color. They're not going to hire another woman or another woman of color if I don't push through.
Right.
I mean, so there's a physical and a mental thing that goes with this.
Yes, absolutely. I have friends. I would say out of 10 of my friends, 7 of them suffer from fibroids. One in particular, doing a homecoming event, I didn't know what was going on, literally had a bleed out at a homecoming event, and I didn't know what was going on, but she had to sit there until her husband got there to help her. So people don't even understand what's going on. So when it happens, and I mean, we got to be raw here. When the bleed out happens, what is actually happening? And some women, and there's no warning.
Right. These women they'll bleed heavily each month, and they'll think that they've got it under control. They'll wear the biggest pads possible, double up on them, wear period panties, Depends, and they think they got everything under control. And it's still, the amount of blood can be so much that it just overwhelms everything and runs down their legs. But yeah, and that's important for men to understand. So, not only when we talk to women, we commonly are all over the country talking about this to women, we love it when men come out to the events, because men really don't understand about women's periods.
Yeah. Why aren't a lot of OBGYNs offering this type of knowledge to women when they come in, knowing that this procedure is available to many of their patients? What does it come down to?
It comes down to a couple things. One, it comes down to the fact that OBGYNs are surgeons. And I've never met a surgeon that didn't love to operate. And all they feel is everything they are trained is cutting, operating. And so that's their mindset from the
Not all of them, right? Not all of them.
A significant number of them.
Okay.
And then it comes down to financially. I mean, some of them see what I do as threatening. It's a disruptive technology, if you will, and replaces the second most common surgery done in the United States. And so this could help a lot of women, but at the same time, the gynecologists are thinking, oh my gosh, I rely on this income, to do what I do. And so it can be very threatening for some, but women are entitled to know all the options. They're entitled to know all the treatment options, the pros and cons, the risks and benefits, and then they make the decision. That's not what's happening. They go to their gynecologist suffering with fibroids, and they get one option.
Hysterectomy.
And they'll say, anything else? Nope. And particularly if they're done having their kids. I hear that all the time. Well, my gynecologist told me I didn't need my uterus anymore because I'm not interested in children, or not interested in more children. That's ridiculous. Your uterus is really important for a lot of other things besides childbearing. So UFE replaces hysterectomy. And any woman that's been told she needs a hysterectomy for fibroids almost assuredly is a candidate for UFE. So there's a lot of myths surrounding it. It will treat any number and size fibroids. Fibroids are not too big or too many. This procedure, UFE, is covered by all insurances. So that's not an issue. It just isn't being told and needs to be.
Right. Can you break down what exactly is UFE? Can you tell us what that means?
UFE, uterine fibroid embolization, or some people call it uterine artery embolization, UAE, same procedure. Basically, the access is either at the top of the right leg or in the left wrist, and we take a catheter, like a piece of spaghetti, and we steer it under X-ray guidance into the uterine arteries one at a time. There's a uterine artery on each side of the uterus, and it branches like a tree, getting smaller and smaller branches to get out to the leaves. The fibroids are the leaves of the tree, and I know what size those small branches are, and I can plug them up. So the big trunk and the main branches of the uterus stay open. The uterus is alive, and I've had numerous children after UFE, multiple sets of twins, and our births are vaginal, whereas if you have the surgical myomectomy, you're getting C-section. But so you can knock out all the fibroids all at once. So typically it's a one-time procedure. It takes about 30 minutes or so. They recover for several hours at our center, and they go home literally with a Band-Aid at the top of their right leg where we go in. That's it, a Band-Aid. Recover at home for about 5 days.
So there are a couple of procedures where women say, well, I got this procedure done, but my fibroids came back. Does your procedure, what is the guarantee that the fibroids won't come back? Or is there a guarantee?
Well, it's very unusual for them to come back, but if they're young, I mean, if they're over 40, 40's young, but if they're in their 40s, it's usually a one and done because it knocks out all the fibroids, and before they could ever grow new ones, they're in menopause, which usually ends the fibroid saga for women.
Okay.
But if you're young, if you're in your 30s, say late 20s, you have a longer time horizon, you could grow new fibroids, but I would still say in that rare, unusual circumstance, 2 UFEs is still way better than 1 surgery. But if you compare it to, say, myomectomy, the surgical procedure done for women interested in fertility, that has a very high recurrence rate because you can't surgically cut out all the fibroids. It's just, you wouldn't have a uterus left. So they know they leave behind fibroids that are alive after surgery. And some of the unfortunate women, they try to take out too many and they end up taking a hysterectomy. But the ones that wake up with their uterus, they all have living fibroids in there. Whereas none of the patients for UFE should have any living fibroids.
Okay.
We knocked them all out.
Right.
So the ones that are alive after surgery, they're going to grow. So the recurrence rate for myomectomy is about 11% per year.
Okay.
That means over half the women will need something within 5 years.
Okay.
Whereas UFE, most likely, if they're in their 40s, never.
Wow.
One and done.
That's good. So what can we do to change, I guess, conversations like this?
Yes.
What else do we need to do to make women more aware of this particular procedure and the benefits of it?
Well, I think the start is, as you say, it's increasing conversations. There's a lot of stigma and shame around women's periods, and we could stop that. I mean, at the Atlanta Fibroid Center where we try to help with the period poverty aspect. There's that aspect to it. But then there's kind of in my family, we don't talk about periods. Well, we got to really try to end the shame and stigma of talking about it. As I mentioned, men need to know about women's periods because there are going to be women in your life, most likely, and you need to know about this stuff. So increasing the conversations, women amongst each other. So we're out at sorority groups and women's health groups. We're talking to any women's group that will listen, just so they'll have the information. Information is power. The more information you have, the better informed choice you can make, because you're typically only going to get one choice now. But if you know about these other choices, then you can pick what's best for you and make the best informed decision.
What are the risks of your particular procedure?
Well, any procedure has risks,
Of course.
but obviously the risk of a procedure where they're going home the same day with a Band-Aid pales in comparison to the risks of cutting you open. And the cuts can be pretty significant, either horizontally hip to hip like a C-section, or if the uterus, which is commonly above the belly button, they'll go vertically, breastbone vertically all the way down to pubic hairline. It's big time surgery. Our patients get a Band-Aid, but there are 2 risks that women need to know about. One is there are some women that don't menstruate ever again after the UFE. Now, I've never seen that happen in anybody under 40, but as you get above 40, you can start to see it. 40 to 45, about 1 to 2%. 46 to 49, 5 to 10%. And when you get over 50, about 20%. So those women usually are laughing when I'm talking to them as a risk, because they're not interested in fertility and they're having horrible bleeding, and they're like, I hope that's me kind of thing. It's not a risk at all. But I explain that risk to them. The other risk, about 5% of women will temporarily pass some fibroid material vaginally.
Okay.
And it's okay. It's totally fine. It's just they just need to know that could happen, so they're not freaked out about it.
Yeah. So many women have had this procedure done, a lot of women in the Divine Nine and others, of course. But when we continue this conversation, I want to make sure that we get I'm sure because you've done so many procedures on women across all of our sororities. So definitely want to have their hands-on experience with you. But what's your last piece of advice to women who are suffering, who have been told that they have no other option? What would you say to them right now if they were coming to you or had the opportunity to come to you or a similar doctor to get this procedure?
Well, a couple things. One is nobody knows your body better than you. So if you're going with concerns and you're not being listened to, or you feel you're talking about your periods and the doctor's not listening to you, you're being dismissed. Oh, well, you've been doing that for a long time. That's just your normal. No, if you're bleeding such that it interferes with your quality of life, it doesn't matter what your hemoglobin level is. It doesn't matter what your doctor says. That is not normal, no matter how long you've been doing it, and that needs to be corrected. So if you're feeling dismissed or not listened to, find another doctor. That's what I would say first. Second, no matter what your doctor says, no woman has to have a hysterectomy for fibroids, no matter what he or she tells you. You don't have, it's an option, but in my opinion, it should be the option of absolute last resort, because fibroids, while they cause miserable symptoms, or can, they're benign. They're not cancerous. So essentially, why are we amputating young black women for benign disease? It's totally unnecessary. It's an option, but it should be the option of last resort, not the first and only option that's given.
Before we ask you for your information, how people can get in touch with you, how early should we be having these conversations? I have two teenage girls who are menstruating.
Yep.
And so, couple of every now and then they'll have a heavy one. How soon should we be having these conversations, and how do we determine if we're suffering from fibroids at an earlier age?
Yeah, well, I think the conversation should begin now. You have teenage daughters, they're old enough to understand about their periods. They already know probably stuff about it. It's important that they know about fibroids and know, fibroids are the most common reason why women have abnormally heavy periods. And so it is something that should be discussed with them. And also what's normal, because as I mentioned, sometimes women bleed heavily for a long time and they think it's their normal just because they've been doing it for so long. If you have to use more than a pad at a time, or you're changing a pad more frequently than every 3 or 4 hours, or you're getting episodes of blood gushing out or flooding or passing big clots, blood running down your legs, or you're afraid to sit on your girlfriend's couch or sleep without plastic sheets. I mean, all those things are abnormally heavy. It doesn't matter how long you've been doing it. So recognize first what's abnormally heavy, and then seek out options of why am I doing this? And if it's fibroids, UFE is tremendous. It's an absolutely phenomenal procedure, but unfortunately, you almost have to know about it, because most gynecologists won't mention it to you. And that's a shame, because women are entitled to know all the options, not just the surgical ones.
Awesome. So I'm glad that we can do that. You mentioned some of the things that we can do health-wise to shrink some of the fibroids and kind of prevent, having to even have a procedure. So I'm glad you mentioned that early on. How can people get in touch with you to find out more information if they are suffering, if they just need an ear, or to continue the process of having this particular procedure?
Well, I'm easy to find thanks to social media and the internet. We have a website, atlii.com. It stands for Atlanta Interventional Institute. That's the parent company of Atlanta Fibroid Center. So atlii.com. We have an Instagram page, which people really like. It's very visual. dr_, my last name, dr_Lipman. They'll see a recent thing I did with Damon John from Shark Tank.
Okay.
He was very nice and wants to do his part and help spread the word. We also have a YouTube channel. If they want to watch me do an entire UFE procedure, 30 minutes.
Wow.
I talk all the way through it. We don't cut anything out. We went from beginning to end, nothing edited. You can watch the whole thing on YouTube. So if you go to YouTube and follow us on YouTube, it's free. It's if you go to Atlanta Fibroid Center in YouTube and you'll scroll, you'll see one of the videos. We have hundreds of videos on fibroids, on diet and fibroids and health, and mostly around fibroids and the UFE procedure. But you can actually watch me do one.
Wow. See, this is real right here because not everybody wants you in the room with them when they're doing something like this. But I'm grateful that you are sharing this information.
In fact, we're having a medical student from Yale come and watch us do a procedure this week. We have lots of gynecologists. I encourage them, hey, I hope you'll mention UFE, but if you're concerned about the procedure or don't know what to say about it, come and watch me do it. Come to our center. We'll have some gynecologists come and see how what their patients would go through. It's very simple, very easy, much easier than surgery. Out the same day with a Band-Aid.
Wow, that's fantastic. Well, we appreciate that so much, and we really love the fact that you're so passionate about it. And, I'll be honest, I was like, man, I just wanted to feel real because if I had suffered and had your procedure, it would be, it'd be like, oh, well, this is my doctor. But because I have not, I wanted to make sure that I'm giving our viewers, our followers, a real experience of why you're so passionate about what you do.
Well, I'm glad you're going to have some sorors that have had...
Come on, sorors, he said it.
Yeah. So it's great because, I can talk about fibroids for hours and hours and hours and bore the tears out of people. But when somebody that's actually gone through it and lived it, when they start talking about what their life was before and what their life is after UFE and how their lives are transformed, that is so much more powerful, so much more impactful than what I'm saying.
Right, absolutely. So we can't wait to do that for part 2 of this amazing connection, our partnership. Dr. John Lipman, thank you so much for joining us today.
Thank you.
This has been fantastic.
Appreciate it.